Hello, and welcome to Timing is Everything, a program of Care Dimensions. My name is Mary Crowe. I'm the Director of Professional and Community Education at Care Dimensions. Today, we have Dr. Stephanie Patel on the show, and she's the Chief Medical Officer at Care Dimensions. Welcome to the show, Stephanie.
Thank you for having me.
Love having you on. And today, I'm really excited about this topic. This is such an important program. Today, we're going to talk about the Home MD program at Care Dimensions. So I'm really excited about this. But before we dive into that, can you tell the audience a little bit about yourself?
I am the Chief Medical Officer at Care Dimensions. I've been there for 13 years. My background is I'm a family physician by training, but I've been practicing hospice and palliative medicine for about 16 years now.
That's great. Excellent. Well, it's like I said, this is a really important program, and a lot of people that the word is getting out to is they're really impressed by this. So tell us some information about this Home MD program. What's that about?
So we're really excited about the program. It is really bringing primary care into the home for those patients who are over 65. And have chronic illnesses or memory loss and find it difficult to get out to the doctor to get their regular primary care services.
That's great. So a few things about it. So you said over 65. So tell us more about really who qualifies.
So anybody who is over 65 and is what we term home limited, which means it's difficult or somewhat difficult to get out, and it's really to the doctors. It doesn't mean that you have to be homebound, so you can still go to the hairdresser or your specialist, but it's time consuming, can take much of the day to get a typical doctor's visit done, or it causes a lot of symptoms for the individual to get out of the house just to get to a doctor's visit.
Yeah, and it can really take a toll on people. I don't think people, they think it's such this minor thing and it's no big deal, but this really can tax people, can it?
Yeah, there's a lot of people who actually decide to stop going to the doctor because it is just too difficult to get out. Maybe it's because they have difficulty getting in and out of the car or getting out of the house or down the stairs, or they just, again, are short of breath. It's difficult with all the oxygen and things they might have to get into a car and get to the office.
Yeah, this is wonderful. I mean, this is really going back to a way that used to be. I mean, which is wonderful because, there were some doctors that did do home visits. Haven't seen that in a long, long time. But it's really wonderful because I think people miss this, don't they?
I think they do, yes, and I think there has been individuals in the community, again, who really have not had the opportunity to have primary care because they just cannot get out of their homes.
Yeah, and this is a big problem, like you say, for older adults, because I do think there are a lot of factors that restrict them from going out to the doctor, and that really causes a whole host of other issues.
It does, yeah.
Yeah. So what are the areas that Home MD serves?
So right now, Home MD is serving 23 towns on the North Shore. We're not going out of the North Shore. We are slowly adding towns here and there, but right now it's primarily 23 towns on the North Shore.
Great. So people really should check in, though, right? Because again, sometimes people think, oh, maybe it doesn't cover where I live or things like that, but they should really check it out no matter where they live.
Yes,
right?
I would encourage them to call and find out if we're currently covering their town.
Excellent.
And that. The program also is not just for those who live at home. We also are in 20 assisted living and rest home facilities on the North Shore again. So it is patients that also can reside in those facilities.
Yeah, which is important because, again, people think that it's just in the home setting. And assisted living actually is a home setting.
Correct.
Right? So the question is going to come up to, so does this go out to skilled facilities?
No,
right.
We currently do not go to skilled facilities.
Okay.
But assisted living and rest homes, group homes,
yep.
and pretty much any place that somebody calls their home.
Yeah, and that's really clear that these are people's homes, and there's a lot of independence and all that goes on in those settings.
Correct.
Okay, so that's important to know. So talk about the services stuff. What goes on there?
So the services are really very similar to what goes on if you go to a primary doctor in your office. We do, annual physical exams. We do sick visits. Okay. Follow-ups after a hospitalization, or if you've happened to go to the emergency room. We are able to offer some vaccines at home. We're able to arrange, if you need it, for home lab draws if you're unable to get out to a lab drawing facility. We order all those labs and follow up, as well as we can get x-rays as well if that is needed, but we can also refer you to a specialist. We connect with your specialist just like your regular, an in-office primary care physician would do.
That's excellent. Now, I think a big question is, because again, this Home MD program is coming from Care Dimensions, which does hospice and palliative care. Do you have to be on hospice and palliative care to actually be part of this program?
Absolutely not. Home MD is for anyone in the community. You don't have to be previously associated with Care Dimensions or be on hospice and palliative care. Now, you can be later referred or also take advantage of hospice and palliative care, but you do not need to be on either.
Yeah, I think that again is really important though, because some people think that because this is a part of Care Dimensions that's a criteria, and it has nothing to do with it at all.
Correct.
Yeah.
No, this is a completely different division program for Care Dimensions.
That's great. This is excellent. So some of the when you're thinking of this for people, what are some of the other benefits? You talked about just this and the difficulty in terms of people getting out. This isn't just a benefit for the individual. This is a benefit for the family and everybody, isn't there?
It is, yes, because if you are currently a caregiver for someone who has difficulty getting out, you can imagine that you have to take off work. It's very difficult for you to spend the time to get your loved one to visits or office visits. Also, if you happen to be a caregiver who lives far away and you're just concerned, this can give you some peace of mind knowing that there's a doctor or a nurse practitioner that's coming in and regularly following your parent or whoever that might be. So there are a lot of benefits. I think it gives a lot of people peace of mind. Yeah. And again, I think it fills a void in the community and helps those who haven't been able to see their doctor, can't manage getting into a regular doctor or can't somewhat coordinate their own care, because having somebody come into the home, we're also able to help you coordinate that care from your home.
Yeah.
So.
Yeah, and even with the aspect of there's such a component of isolation too.
Yes.
This really helps on so many different levels, doesn't it?
It does.
So how is this covered?
So it is covered just like a primary care physician would be under insurance. So most insurances will cover this. If you have an HMO type insurance or a Medicare Advantage, you would have to choose our physician as your primary care physician, just as you would, choose an office-based primary care physician.
Yeah. So people don't have to, because people are thinking, oh my gosh, somebody's coming to my house, so this must cost an arm and a leg. It's really not. Like you say, this has to do with just how you would go to your regular physician.
Yes.
And it's just they're coming to you instead, so they don't have to worry about this isn't something I can afford.
Correct. There's not an annual fee or any additional fee for traveling to the home. It's just your regular, if you have a deductible or a copay, that would apply. Yeah. We also, would be covered by Medicare's secondary insurance. So there is no additional cost to a patient or a family that they wouldn't get if they went to a normal in-office doctor.
That's great. Can you talk a little bit about who's on the team?
So right now on the team, we're lucky to have Dr. Mark Messenger, who has practiced home primary care since 2007 on the North Shore. He is currently our medical director, and we have 2 nurse practitioners that have joined him as well. And we have in the office, we also have nurses and office staff
That's great, great. So, and he's very well known,
Yes,
you
he
know,
is.
in the community. So this is not something new to him.
No, this has been what he has sort of specialized in since 2017. He really enjoys going into the home and taking care of these individuals who otherwise often don't get in to see a physician, or it has it's a lot of difficulty.
Yeah, he's very highly regarded. I was talking with a group last night, and it was mentioned, and people were just thrilled because he has a great reputation out there. And again, this is something that is very familiar and something he's very passionate about. So it's not a new concept for him at all. So it's great that, again, it's not something that's offered very much out there, that he's continuing to do this, and that Care Dimension has made this a part of the services they provide.
Yes, and he's also, training these two young nurse practitioners, and hopefully, if the service continues to grow, training some young doctors to want to do the same, because it is definitely an area of need that not a lot of people are providing.
Yeah, I mean, and we're looking at a population that's just getting older. So the need is not going to go away. It's
No.
only going to get greater, right? So,
It is, yes.
So when we're looking at the baby boom generation and the numbers, it's really the people, this large number or group of people are actually getting into this older group. And again, people want to stay at home.
That's the key. Lots of people want to stay at home. They don't want to be going into a facility or into the hospital. And to be able to provide their primary care right where they live is pretty amazing. And again, as you said, it's kind of going back to where medicine originated.
Yeah. And it worked. So it's really getting back to something that was very effective, and it's kind of a shame in some ways that it came out of that, but the times change, and here we are again needing to go back to that. And I do think you were right. You were talking about for older adults, it's really sometimes they're just choosing. And it's not really a choice. It's really because they just can't do it.
Yes.
So it's kind of like their hands are tied in some ways, where they're just sacrificing the quality medical care that they need because this is just such an arduous task for them.
Yeah.
Yeah. So other things about it. Tell in terms of other parts of the program, other things that people need to know.
I think some of the other benefits we didn't talk about are that often these individuals, who it's so difficult to get out, have trouble even navigating inside the crazy healthcare system that we have. I think your doctor coming to your home, and the way we've set up Home MD, our practitioners follow less patients.
Yeah.
And so they also help you navigate, the things that you need and what's essential, and, getting extra services or equipment and things like that in the home. And they make an extra effort to call anybody that you're referred to. I think I honestly can say they know their patients very well.
Yeah.
And so I think it's more personal care,
Right.
As well.
Which is wonderful because, as we were just talking about, boy, that's changed, hasn't it? Just the demands of healthcare, all of that. And I feel like sometimes people feel like you're given a certain amount of time, people are rushed in, rushed out. And for older people, they really can't do that. It's hard, and then they go with a particular thing in mind that they want to discuss with a physician, and it can be such a stressful event that they're not even getting addressed what their primary purpose for being there.
Yes.
So this must feel, really getting back to, like you say, feeling like there's a connection between the practitioner and the person,
yes.
and all of that,
and not just the patient, the family as well.
Yeah.
I also think it's important that people understand that once you're established with the program, we are seeing a lot of patients on a same-day basis. If they call in and they're having a new issue or a problem, the providers are able to rearrange their schedule and get out there so that patients are seen in a really timely manner. It's not calling up and, waiting, saying my next appointment is in, 4 weeks.
Right.
They're out the same day often or the next day.
Well, that's great. And that was going to be one of my questions, which is, what is the time frame? How is that working in terms of the referral process, getting on, doing all of those things?
So once somebody calls in and we get their information and, verify their insurance, all of that, we're unique in that Dr. Messenger himself calls every patient to talk to them and set up their first appointment. So that's usually, it may take, 4 or 5 days for that first call back from him. And then he's usually scheduling in to see you within a week.
Wow, that's great. And again, I love that personalized care again, and people not feeling like they're just a number.
Yes.
And the healthcare system, and again, getting back to that real need for connection, and I think too, again, not feeling rushed, not feeling overwhelmed, and I think that it just makes such a huge difference in people's lives.
It does.
So this is great. So other things that I haven't asked you that would be important for people to know about this program. And we talked about the areas and things like that, and I worry that people think, oh, this doesn't apply to our area, but people should, again, just call in. And we talked about the time frame, things like that, who's on the team, other things that you can think of. I think we covered a lot of these, but I want to make sure we don't leave anything out. How do people make a referral?
So we've had children call in for their parents. We've had, patients call in themselves. We've had next door neighbors giving it to somebody. So honestly, we usually contact with either the, family member that's the healthcare proxy or the caregiver or the patient themselves. But we've had referrals from a lot of people. We've had organizations refer patients as well. We've even had some other PCPs calling and saying, this person can't get in anymore, and they really need, a physician that can go out to the home. So
right. Yeah.
We've been getting them a lot of different ways, and rarely are we unable to see a patient. Usually it's that we just are not in that town yet.
Yes.
For whatever reason that might be, but.
Yep. Yeah, but there are, like you said, there are physicians, and I saw this recently too, because people, I think, worry sometimes about, how is their physician going to feel? I've actually seen the physicians encourage because of the person's inability to get out.
Yes, so I don't think, I think most physicians understand that when you get to that stage, and they would rather have somebody who's able to see you,
Absolutely.
Caring for your medical care rather than you either not coming in and getting any medical care or just, using the emergency room, which sometimes is the only option for people.
Yeah.
So yes, I've not seen any primary care physicians reluctant when they have determined that it's really difficult for their patient to get to the office, or that sometimes they just can't.
Yes. Yeah. Are there particular hours that the service is available, that sort of thing?
So for new patients, we're available 8:30 to 5.
Okay. So standard
hours,
office
and then we always have a provider available 24/7. So we don't make visits usually into the evening or on the weekends, but that's usually, I have seen some visits made. Depending on the patient's need, again.
Right, yes. So again, very personalized in that way. But like you say, this is standard. Again, if you were going out to your general office,
Yep.
Your internist or whatever, your primary care physician, it would be around the same time and all of that. So it's functioning very much in that same way. It sounds like
it is. It's not indifferent, except for that we are coming to you.
Yeah. I think there's also a component too. I was just thinking about the benefits of this. Boy, isn't it a wonderful addition that you get to see the person function in their own environment?
It is for the provider, yes, I think, and as well, ultimately for the patient, because we can again address and see whether there are things that you wouldn't naturally tell us if you came into the office, but because we see you functioning, we realize that you may need some additional services or some equipment or things like that we would have been unaware of had you come into the office.
Yeah, so again, this is really like around a quality of life issue, and I can only see that that can enhance it. And like you say, I think sometimes it's, people might keep certain things from, but I think most times people just don't think to bring it to you
Correct.
about those sort of things that would be helpful for a physician, or even feeling like you don't have time to really go over that. What's important, sometimes we don't really think about that.
Yeah.
What would be important for the practitioner to know. But when you see somebody in their own element, it just it provides a whole host of other benefits for both parties.
It does.
So how are people going to get a hold?
So if people want to inquire about becoming a patient of HomeMD, they call 1-888-281-0011.
Great. So we have this card up here now, and again, so people should just call in, and if they have any questions, right?
Any questions about what we discussed here, or just any other questions that might come up, feel free to call. Again, we're there 8:30 to 5.
Excellent. And just in terms of, I just want to reiterate again, because I think people are going to still get this confused. They do not have to be on hospice or palliative services, right?
Correct.
They do have to be over 65 years old.
Yes.
It doesn't surround diagnosis.
No.
It really surrounds the need in terms of those ways, in terms of the qualifications around that.
Correct.
Right?
It's really, it doesn't matter what diagnosis. It's really more related to the home limited, that you have difficulty getting out of the house for whatever reason.
Okay, great. And again, I think sometimes people hear of that homebound, and I'm glad you brought that up too, because when they're thinking of like the visiting nurse requirements or regulations, they're thinking, oh, you have to have a homebound status, but that's not what's happening here.
Correct. No, you don't have to be homebound.
Yeah. And like you say, some people think, oh, because I got out for lunch with a family member, that this doesn't apply to me. That's not true. It's not uncommon that you might be able to, even if it has an impact on you, that you might be done in for a while afterwards. You're having that quality of life, but it doesn't prevent you from being able to go on a service like this.
Correct.
That's great. So what other points would you like people to know before we have a couple more minutes, but before we wrap up, is there anything else that you want people to know about this program that would be helpful to them?
Really, I would just encourage people. I think it's a wonderful service, and I'd encourage people, if you know somebody that this might benefit, if they're in your family, if they're a friend, that you just spread the word and let people call and see if this is something that they might feel like that they would benefit from.
Yeah, even if like you say, if not for you or a family, even if you have neighbors or other people, you bring this information to them.
Correct.
Excellent. Yeah. Anything else, or is we covered everything, I think. So, I also want to make sure that we bring up, so if people have any questions, we brought the number up for that, so feel free to call in and ask. The other thing, too, is if anybody has any questions around hospice or palliative care, please call Care Dimensions or even support services. We do a variety of things, so we have the number up there right now with the phone number and the website. Please feel free to call us and ask any questions that you have. We're happy to help. So, well, Stephanie, thank you so much for being on the show today. We really appreciate it.
Thank you, Mary.
And this is a fabulous program, and I feel very fortunate, for people out there, and certainly and very proud from the organization's perspective of offering such a valuable service. So thank you.
Thank you.
Care Dimensions, formerly Hospice of the North Shore in Greater Boston, is different in that we do more than just hospice.
It's just incredible, the services they provide when people need it the most.
So being able to offer more individualized care helps people feel more cared for.
Because it's about the patient's quality of life.
I don't think there's any place else in the Boston area like Care Dimensions.
At Care Dimensions, we'll take care of your family like you're a part of ours. Visit us at caredimensions.org.